It's my pleasure to introduce Dr. Gina Vincent, who is Professor of Psychiatry and Psychology and Co-Director of the Law and Psychiatry Program, who will talk about this special lecture and introduce our speaker, Dr. Pinals.
Thank you, Tony. All right, welcome everybody. I want to say thank you for coming to our special lecture that the department has agreed to fund every other year, and we thank the department for that. This is a special lecture because it is on behalf of Dr. Kathleen Thompson-Hall, who many of you probably don't know. She was here at Worcester State Hospital, and she worked in the forensic area, and she was a psychiatrist. And in 2000, her teenage daughter took her life. Her teenage daughter had, as I understand, a serious mental illness. And for that reason, and some of you remember her, and our guest speaker today actually worked with her. So this is the perfect speaker for this lecture. And I am very honored to introduce Dr. Debra Pinals, and it is a very hard introduction to do because her bio is about 3 pages long. But many of you know her or may remember her as our former director of the Forensic Psychiatry Fellowship. And if you didn't know her in that capacity, you may have remembered her as let me make sure I get this right, the Department of Mental Health's Assistant Commissioner of Forensic Services. And before that, she was an area medical director for the Department of Mental Health in Massachusetts. She is an incredibly accomplished individual and professional. She is board certified in psychiatry, forensic psychiatry, and addiction medicine. Today, she has at least 3 different titles, which I will review quickly, but she's Senior Medical and Forensic Advisor and Editor-in-Chief of the National Association of State Mental Health Program Directors. And she's the Medical Director of Behavioral Health and Forensic Programs for the Michigan Department of Health and Human Services. And she is also Director of the Program in Psychiatry, Law, and Ethics, an adjunct clinical professor of psychiatry at the University of Michigan Medical School. But as I understand it, she resides in Massachusetts again, which is to our benefit because she's here today. She's had many esteemed positions. She was the president of Apple, many other organizations, and today she is a consultant for the SAMHSA Gaines Center. And I could go on and on about her. She is a wonderful colleague and friend to our program. It's wonderful to see so many people here from Law and Psychiatry, but I know she's got a wonderful talk to give us, so I'm going to turn it over to her. And thank you very much.
All right. Well, you guys are lucky to have Gina because Gina's amazing too. And I really appreciate that very warm introduction. It is incredible for me to be here. I was reminiscing down memory lane of when I came in, probably it was 1998 when I wandered first to the UMass campus and met with some of my colleagues where I spent a lot of my career, my formative years of my career here at UMass Medical School. So it's just really wonderful to be back and see all this change and growth that the department has had. Let me just, of course, start by saying, despite all of my titles, I have no actual or potential conflicts of interest related to this presentation. I do consult widely to government sectors, private foundations, consulting firms, attorneys, and clinical health systems, but the opinions I express are my own and don't reflect any of the views of others. I also just want to take a pause because it is really emotionally powerful for me to give this lecture on behalf of the memory of Dr. Kathleen Thompson-Hall, who actually was a mentor to me. She was working at MCI Framingham as an attending psychiatrist when I had the idea of trying to work there too, but I had never worked in a jail or a prison. And she really mentored me with that population and was a big advocate in her home state of Arkansas and had done a lot of legislative work for bettering the lives of people with mental illness. And so it was with a just shock, I will never forget the morning of getting the email to hear that she was in the ICU here at UMass with a traumatic brain injury and succumbed to that injury and the aftermath. And, now fast forward 23 plus years, what she could have contributed to the world, I'd like to think that any little tiny bit of her mentoring, that I carry some of that water with me as I go forward, because she was a bright spirit, a bright woman, and really was committed to the work that eventually her daughter needed to benefit from. And so I just want to give a pause to reflect on Dr. Thompson-Hall. I also want to thank my colleagues because some of this work stems, one of my many jobs, but one of my jobs currently in Michigan is I review all the people found not guilty by reason of insanity who committed murders or sex offenses, who are stepping from our secure hospital down to regional hospitals or out into the community, many of whom have committed murders of family members. And worked with a group of colleagues in the Group for Advancement of Psychiatry on this book on family murder. If you're interested in this very difficult topic, it's a very interesting book. Every chapter is about different angles and aspects of that. And we spent a lot of time at the table discussing each of our chapters and trying to create a uniform view of how we look at this. And I also want to say that since I do work with families who have suffered these great losses, and I have worked with a lot of patients who have perpetrated these very painful actions. They struggle daily with their histories, and I think they bravely work to overcome their troubled past. And I like to think that a lot of this talk and my work is dedicated to them and their struggles and the struggles of the families that are trying to reconcile how could something so horrible have happened. So with that, on that sobering note, it is a sobering talk, and many of you may be generalists and say, well, is this really applicable to me? But I highlight some of this to say that, again, it's a rare event that someone would kill a parent, but it does happen. And it could be your patient who does that. And so it's really important for generalists to be just as aware of rare events, like we are in medicine all the time, as we are for common events. So you may be a forensic specialist, that's great, but I think it's something that everybody needs to think about, even though it can be painful to think about. So I want to spend a little bit of time just describing the history and phenomenology of parricide, delineating patterns of parricide regarding perpetrators, motives, and methods, and then describe aspects of treatment, which is some of the most fascinating work I've been involved in and outcomes related to this. So let's start with the history and phenomenology. So I just want to be clear what we're talking about. Parricide is that fancy word that refers from Latin to the killing of a close relative. And in historic times, it was punished very, very severely. It received what was called the peniculaire, the penalty of the sack. And now when we talk about what I'm focused on, which is the killing of a parent, there are many different terms that could delineate the type that we're discussing. Parricide is the general term of someone of any age who kills their parent, whether it's a biological parent or not a biological parent, but the person in the parental role. But you can see that there's other terms. Matricide is the killing of the mother. Patricide is the killing of the father. Step patricide, the killing of a step parent. Double parricide is the killing of both parents. You see that referred to. Family annihilation is an individual who kills all of their family members, including their parents. And offspring perpetrated homicide is another term. So when you look at the literature, one of the things that makes it challenging is that the literature may use different terminology at different times. Now, this goes back as long as man has been man and people have been people, I should say. And it is certainly, this phenomenon has been depicted in everything from literature, Shakespeare to mythology. Here is a portrait of Oedipus. We all know the Oedipus complex. What we think about with the Oedipus complex is we think about the sexual aspects of the Oedipus complex. But for this lecture's purpose, the way to have sex with the mother was to kill the father. And so in this is a picture of him killing his father unconsciously, fulfilling the first part of the prophecy that he would that he was fated to kill his father and mate with his mother. And so that takes on a life of its own in our mythology about what the purpose is of killing one parent or another, with this sexual theme that Freud really became very well known for. But there's parricide mythology across almost all cultures. I obviously didn't review all cultures, but here's some very interesting ones. In the Hindu culture, there's a myth. I'm not going to try and say these words because I don't want to mispronounce them, of someone who killed his father, who was then brought back to life by the wife. The Greek culture has someone killed or castrated so that he could usurp power and domination of the universe, and then was overthrown in Zeus. Remember, we have the Orestes complex, which derives from the tale of Orestes, who's persuaded by his sister Electra to kill their mother out of revenge for their mother's killing of their father. So there's revenge motive and sibling dynamics. In Babylonia, there was the Babylonian creation epic, which involved someone who was killed by his son, Ea, in the struggle for supremacy amongst the gods. There's Norse mythology of Fafnir, who murdered his father to gain the cursed golden ring against, or for some power dynamic. In Chinese culture, where it involves someone who commits a patricide or a matricide will be killed by a lightning strike as a punishment from a filial and warrior deity. So this really is something that is really deeply, deeply embedded in our cultural dynamics and views of something that is a powerful thing to have happened. And so that when it really does, it brings up a whole host of deep, historic, culturally rooted emotions that goes beyond the murder of a stranger. In the modern era, there's a couple of cases that I want to highlight. This one, have any of you heard of the Parker Hulme murder in New Zealand? This is a fascinating story of two young girls who, and there was a movie, I'm going to show you a little bit of a trailer about it.
Just the next slide.
Click next slide.
Yep.
He's got it all set up for me.
They were two young girls living in a world of imagination.
I'm going to the fourth world. It's an absolute paradise of music, art, and pure enjoyment.
What they had was friendship.
What a disgrace you are!
Your mother is rather a miserable woman.
What they needed was freedom.
Do you like your mother?
No.
What they shared was a secret.
Your daughter's been behaving in a rather disturbed manner.
What's she done?
I think I'm going crazy.
I'm sure it's perfectly innocent.
The crime that shocked the nation.
People die every day.
Only the best people fight against all obstacles in pursuit of happiness.
Paul thought it up.
Aren't you clever?
We're not going to be separated.
She's uncontrollable.
Based on a true story.
It's all frightfully romantic.
Heavenly creatures.
Romantic.
Based on a true story.
It's all...
On the screen? Here?
Just anywhere.
Based on a true story.
It's all...
There we go. But I need to go back to the...
Oh, okay.
That's right. Let me go here.
Just that.
Okay, so in this story, thank you. In this story, again, just tragic. It's a great movie that was made. These two young girls, one was 15, one was 16, had developed this very close and intimate relationship. There was a lot of speculation about whether it was a lesbian relationship. They came later and said it was not, but they ultimately, through that dynamic, had plotted together to kill Juliet Hulme's mother. Pauline Parker's mother, and basically talked about the happy event is to take place tomorrow afternoon. Next time I write this diary, mother will be dead. And then basically, as these two young girls face these charges, I'll talk a little bit at the end of the talk about what happened to them. But it was really kind of struck the nation in terms of what could have motivated this, this terrible crime. Another, here we go. Another one that I want to talk about is the Menendez brothers, which was another famous case. This one in the United States, more recent. In 1989, they brutally murdered both their parents, shooting one of them in the head and one of them in the back of the head and one of them in the face. And these were very well-off young men. They had initially denied the crime. Then later they talked about having been sexually abused by their father. That was not considered in the evidence. And actually what was very interesting about this, we used to read this in Landmark Case Seminar, there was information that was shared in therapy by one of the boys to the therapist about fantasies of killing the father. And there was a whole big court case about whether that information was privileged or not. There was a 1992 court case about allowing some information from therapy to be used in court, which is another interesting thing to think about. Again, if you're doing general therapy and you're having these kinds of issues, what information can be used later? There's a whole bunch of legal analyses about that, which we can talk about if there's questions. But in the end, they were convicted. They were this data or claim of abuse was not counted. And I'm going to just show you another little film clip about them.
We turn next tonight here to the case that captured the attention of this country. The Menendez brothers, Eric and Lyle, convicted of killing their wealthy parents. Lyle Menendez now speaking out from behind bars for the first time in 20 years, telling a side of the story never heard before. ABC's Terry Moran on the case from day one.
Tonight, for the first time in 20 years, Lyle Menendez speaking out from prison.
I am the kid that did kill his parents, and no river of tears has changed that, and no amount of regret has changed it.
Beverly Hills, 1989. Jose and Kitty Menendez are brutally murdered.
What's the problem? What's the problem? I'm trying to kill my parents. Were they shot? Yes.
From the outside, brothers Lyle and Eric had it all, but behind closed doors, they describe a cauldron of secrets.
Tell me as clearly as you can why you murdered your parents.
Sitting down for an exclusive interview with Barbara Walters in 1996.
I had said to myself, I am never going to let my father touch me again.
Their defense, an act of desperation after years of abuse at the hands of their father. But a jury ultimately found them guilty, and the brothers were sentenced to life in prison.
My own childhood prepared me surprisingly well for the chaos of prison life.
Lyle Menendez is 48, and he's more reflective now, his life behind bars always shadowed with regret.
It's still a failed, destructive ending. It's part of the tragedy of it. It could so easily not have happened.
It's fascinating. Terry's with us now. And Terry, I'm curious, when was the last time these brothers actually talked to one another, if at all? And is there any chance they would get out of prison as they look forward?
Well, the last time they saw each other was about 2 weeks after Barbara Walters' interview, 20 years ago, and they will probably never see each other again. And no, their appeals are exhausted.
All right. As we said on this from day one, Terry, thank you. And the ABC News special.
All right. So there you go. Some real life examples that I'll again give you a follow-up on both of them at the end of the talk. But these are two examples potentially motivated by different reasons and with different backgrounds to each of these. And so now I want to talk a little bit about patterns of parricide regarding the perpetrators, the motives, and the methods that we know in the literature, and bring it back a little bit to our world of science. Epidemiology, it's important to realize that the studies vary. It's a very hard thing to study. Many of the studies look at general FBI databases that really look at homicide and victim, but by doing that, you're sort of eliminating, sometimes you can't tell really what the relationship is. And so that there's some gaps in that data. There's other studies that have looked at secure treatment facilities, places like forensic hospitals, where there's going to be like the patients I see in Michigan, or that may be hospitalized in a state hospital, where you're going to have a population, but that would only look at people perhaps that are more likely to be mentally ill or have a mental illness. And then, of course, there's media reports, which only pick up some of the stories. And so, any of our epidemiology is complex because it's not fully known. But what we think we know is that the rates in the United States are 2% of all homicides are killing of a parent. So it's not an insignificant number, but it's not a common thing. Maybe a little bit more in Canada. I don't know. I always thought the Canadians, not to stereotype, were a little different, but again, data is complicated. Patricide is more common than matricide. Male perpetrators are more common than female perpetrators. The parents' average range of age can be anything, young parents to really much older adults. Average in the studies that the parents are in their mid-50s. The offenders can range from very young, we see very young children, to older offenders, even some people in their 70s who might kill their older adult parents. Matricide offenders, same thing, very young to older. And the majority of offenders, though, are under 30. And many of the cases are going to be under 18. And that's another issue that we're going to talk a little bit about. With 25% of the patricides and 17% of the matricides are perpetrated by youth. And very interesting how that happens, and then also what we do when something like that happens by someone who's so young. Now, in terms of sons who commit parricide, again, hard to look at totally what this looks like, but sons who kill their mothers and fathers, we look at some immaturity, passivity, dependent qualities. Schizophrenia is actually not an uncommon reason if there is a mental illness, often single and living with the mother. The fathers may be absent. Again, there's the sons who kill fathers. That's often there's not the other partner to counterbalance. There's often some single, they're single. The mothers who were killed often are described as domineering, demanding, possessive, and often the only victim. Again, fathers, domineering, aggressive, and the only victim. And the relationship to the son is seen as cruel or abusive. And I'm sure we're all going to go home and be kinder to our kids, but I think these are real strong patterns and interfamilial dynamics that are complicated. And again, it doesn't necessarily mean that it's true. It's just how this literature portrays it, and seems to be some patterns, but not for every single case. One of the things we see with both for the sons and for the daughters, frankly, is this excessive force is often used, that it's not just a killing, but it's a killing with a lot of emotional affect. When there are, when we know motivations, there can be delusions involved. It could be for altruistic purposes. For example, the killing of a parent, an older parent who might be suffering from diseases associated with old age, and maybe to alleviate suffering, the smothering of the mother with the pillow kind of phenomenon, that the threat of separation or lots of arguments. And then often there's for the sense of relief initially, and then more remorse as time goes on. In terms of daughters who commit parricide, we see, again, they're often single, living with their mother. Psychosis is very common when the women engage in the perpetration of this crime, but it's not absolute. The mothers often are the only victim. The fathers are often tyrannical. The relationships are often hostile or violent between them. And again, we see excessive force being utilized, and that's something to think about. So really just thinking about Primarily, we see a single victim and a single offender, meaning a child. The stories I showed you before were these kind of maybe two people, with the New Zealand case, and then the Menendez brothers, you see two people engaged in this, but most of the stories involve a single victim and a single offender. And the most common precursor is not psychosis. Most common precursor is arguments, often involving alcohol, interest in money, or property. So control struggles that occur around these things, and disinhibition related to substance use. Often involving child abuse. And again, serious mental illness can be part of that, and financial issues. Some would say there's the sort of three types that we see are the seriously mentally ill, the victims of abuse, and then the more antisocial type of typology. The weapons that we see that are used are firearms in the United States, most commonly. That's probably not a surprise, but blunt instruments, rocks, hammers, things like that for matricide. Most of these take place in the home environment, and often when there's not a lot known by others about what's happening inside the home or how volatile the situation really is. So again, I just encourage people to really understand with their patients, sort of how bad things can get. There is homicide-suicide that is a co-occurring risk as well. We see that. We had an interesting case years ago around a suicide pact between a son and a mother. The mother ended up dying. The son did not. There was a lot of question about whether the son killed the mother or whether the mother actually committed suicide. And the son later committed suicide. I mean, it wasn't clear what was going on. And then a while later, the son did. It was sort of like a delayed murder-suicide. Or double suicide. I'm still not sure what happened with the mom. But again, they typically happen. So there could be something like, if there was a case where you see a suicide pact where only one person died, I would be concerned about the suicide of the other person, because it could be that something just went awry, but that could be just based on my life lessons of cases I've seen, just really thinking about that carefully. Again, this phenomenon of overkill, excessive destruction to achieve death, multiple stabbings, we see decapitation, mutilation. Certainly what I have my fellows do these cases with me when we do these reviews, and it's, you can see all sorts of things that are happening, stabbings, fire settings. Afterwards, people may not have full recollection of what happened. That can be part of the challenge in trying to figure out how to move forward with the case, and whether it's the legal case or even the treatment. We'll talk about that a little bit. Often when we see overkill, that's going to be a psychotic phenomenon, or substances. Again, more common in males. The early views of parricide involved these views of religion and sin, that somebody was feeling that they were sinners and that there was some kind of religious component to what had happened. We don't really take a faith-based approach as much as we probably should to some of these issues anymore. We've moved on to these more criminological or forensic type of analyses that involve looking at this as crime, looking at the perpetration of this as worthy of punishment, as opposed to other types of actions. The motivations, of course, can be combined. And again, now we are, I think, shifting more. Certainly the role of trauma is becoming more and more relevant as we look at criminogenic theory and understanding how people move from into their personalities, even antisocial personality disorder, and what is the role of trauma, and what is the role of early substance use, early exposure, multi-generational trauma, and things like that. Not that again explains all of this, but it is something that we trying to move, as we look at these cases more holistically, those are important things to think about. Other motivations being an abused child. Again, the Menendez brothers are an example of that. Often we see years of abuse, and this is the culmination. Now, this is different. You may have heard about the phenomenon of battered wife syndrome, which is a little bit discounted in criminal law now. That's really, we look at this more as cycle of violence, PTSD, trauma lens. But in the legal analysis, in the case examples of battered wife, you see a person who has had years of abuse, followed by promises that the abuser will stop abusing. And by the way, it doesn't have to be gender-based, it doesn't have to be a wife and a husband, the classic historical. It could be wife, husband, any combination. But the phenomenon is where there's a cycle of abuse, apology, and then after a while, this person acts in a way where they're just in this self-protective mode, and can be a defense in some states, in some ways, like through diminished capacity or other arguments. This is a little different with child abuse because there isn't this reconciliation phase and promise phase, but it is sometimes seen as cumulative strain and stress. And then, of course, when we have serious mental illness, that's something else. The symptoms can vary. As I said, psychosis is prominent more in adult offenders than juvenile offenders. Capgras delusions, which some people don't see in a career, but if you work in this business, Capgras delusions are not that unusual to see in the forensic world. But a Capgras delusion, does anybody remember what a Capgras delusion is? Quiz the audience. Who remembers? Go ahead.
Oh, me?
Yeah.
It's when you believe that someone is not in their own body.
Yep, they've been taken over by an imposter, and that can often be a reason why the person becomes paranoid that their father, mother is now an imposter, and they're afraid of them. There's other, Adam Lanza, you remember in the Newtown shootings, killed his mother, obviously killed lots of other people in addition, but killed his mother, probably had a fascination with firearms, and the data seems to suggest he had autism spectrum disorder, and the mother's death may have just been a means to an end to leave the house. It's complicated to know what that motivation was. And so, but there could be a combination with abuse. There's also perception of shame or abuse with mental illness. I'll never forget a case here that I worked with for years in the state system of a man who was psychotic about many things, but even in the psychosis, he really did not like when his mother called him by his nickname, Billy. He really wanted to be called William or whatever the name was, but and that's fictional, but it was the sense of shame, even though he was psychotic about many things. What ultimately led to the death of his mother was this day where he felt that she was shaming him. And so we have to look at emotions, and that sort of gets to much of the literature that looks at the idea of whether delusions themselves are going to be risk factors for violence. Really look at what are the emotions behind the delusion, and really understanding what's going on for that person is going to be important. And then, of course, the motivations for the antisocial traits and personality development. Remember, many of these incidents will happen prior to the age of 18, where you technically can't diagnose antisocial personality disorder. You can diagnose conduct disorder, but you see heightened aggressivity, self-serving motivations, more coldness, and of course, Dr. Vincent can talk a lot about psychopathy and juvenile psychopathic traits, which can be a different motivation. And then, of course, there's the heightened tensions motivations, just the heat of the moment, change in circumstances, revenge, anger, where some argument goes too far and maybe the death was actually kind of accidental or not, but it was a heat of the moment type of thing. We really need to look at the mental health of the individual, depression and other mood disorders. And then again, if there's psychosis, schizophrenia would be the most common diagnosis, with either command hallucinations or a Capgras syndrome or a combination thereof. So the family dynamics are fascinating, culmination of complex dynamics that have been going on. Again, I've mentioned abuse, monetary stressors. There can be also one that I haven't talked that much about is this escape from enmeshment, this idea that this is my only way to liberate myself That may have been some of the Parker Hume situation. The girls really wanted to be together. The mother was keeping them apart. And so there was this sense of freedom. And then, of course, drug and alcohol use, something to really think about. And again, the altruistic motive, it could be a psychotic altruistic motive where one believes that by killing one's parent, you will save them from some demon or devil, or save Armageddon from happening. That's a common one that I see, where people think Armageddon's going to happen, and so they have to kill their parent to save the world. Or it could be true altruism, as I said, just trying to end parental suffering. Very interesting. This is a digression, but where you have laws that allow physician-assisted dying, and in the states where you have laws that allow physician-assisted dying, the doctor writes the prescription so that the patient can take their own medicine. Now, Canada's changing its laws, and it's really interesting to see what's happening in Canada, where physicians will be able to administer the medication. That happens in other countries. Now, what happens now in those states is if the parent, one of the challenges, if you believe in physician-assisted dying, is that if somebody's got a terminal illness, by the time they're absolutely ready to take their own life, they may be too weak to take their own life. But if the child administers the lethal medication in the United States, that's murder, and that would be parricide. So it's complicated as we get into, as our laws start to look at this altruistic motive that's at a stage of end of life, what that's going to look like as maybe these laws get expanded. All right, so now I want to switch gears and talk about the aspects of treatment and outcomes of the perpetrators and of the families. So again, as I said, even if you don't work in forensics, these issues are important because we all have to know about these more rare events. You may be involved in doing a criminal responsibility evaluation if you do forensics, in sentencing evaluations in Massachusetts, and then of course risk management and risk assessment decisions as somebody comes into your care who maybe has this history. One time when I was working at UMass, I was asked to do a consult of a woman in her 30s who had a developmental disability, a physical disability, and I think a mild intellectual disability, but she was in a day program, and the day program learned that when she was 15, she killed her parent. I think it was her father that she had killed, but she had been in that program for 5 years, 10, I don't know, but she was a well-loved person in that program, and they discovered this history of hers. And then they were scared. They were like, how are we going to work with her? She's got this history. And so, at the end of this, fancy forensic evaluation was just keep working with her, and she's okay. There were a lot of circumstances to that, but so you never know what you're going to come across. And when we do these assessments, you want to just do your general psychiatric assessment, even though, again, this is really difficult stuff. You want to understand people as they're people from an anamnestic perspective, understanding what happened, the purpose, the planning, the timing, the motivations behind it. Evaluate, again, the evolution of the interrelationship context, because one of the things you're looking at is, yes, this terrible thing happened. For criminal responsibility purposes, you want to know, should the law hold them responsible? But for risk management purposes, you want to know, how do we mitigate this from happening again? Even if the parents are gone, are there other victims that might be at risk? Or are they at risk themselves for suicide? Or is somebody else at risk? So you have to look at all of that as you're doing these assessments and sort of looking at this. So I kind of go through these basic questions that people should think about. And I tell you this because, again, I think even from a preventive stance, some of these questions can help you think about, wow, if I have a patient that's struggling with a family member, maybe I need to think about some of these issues beforehand. Many of the cases that I see, in fact, I would say all of the cases that I see that have been found NGRI after this, there were opportunities to touch this person in a different way early on and lost opportunities. So I really can't emphasize enough the importance of thinking through these issues. So was the act purposeful or non-purposeful, to get at sort of what are the dynamics going on at home? Does this person have impulsivity? Was it planned over time? Was there an immediate precipitating event, like an argument or some immediate substance abuse? What was the longer term context of the pre-existing dynamic. Was there hostility and violence in the family, over control issues, parental suffering, end-of-life decline, or no notable relevant pre-existing family dynamic? We just did a consult in our outpatient clinic at UMich of a young man in his 20s whose father was dying of cancer, and he was getting angrier and angrier at his mother. And he was having homicidal ideas about his mother because he didn't like how his mother was managing the death of the father, the decline of the father. And so just understanding that dynamic and doing careful risk management along the way. Again, revenge, emotional, physical, sexual abuse, self-defense, profit, financial issues, thinking about all of these. Again, was there mental illness? Is substance use a role? And are there any non-parental victims that made the parricide only a portion of the event? That can be pretty tricky, like in the Adam Lanza situation, where his mother was killed on the way to Newtown School. Legal issues, again, mostly these are classified as murders. In some states, they can be classified, there can be other ways, laws, if there's sexual offending going on as well, and there can be sexual perpetration along with the murder sometimes. The legal issues are going to look at, mitigation or aggravating circumstances. Again, the disposition for straight murder, as you saw with the Menendez brothers, it was life sentence, often without parole, except for now that we have, if it's a youthful perpetrator, you can't have, their mandatory life without parole is not permissible. States can still give life without parole if it meets the local state statutory criteria. But if there's not life without parole, then the issue for the young person is what's going to happen. They will get out eventually. And so then what does that mean for their life and for society? Some percentage may go to a mental health facility and be ordered for treatment. And again, if there's psychosis, sanity is often raised as a defense. In the juvenile context, again, state laws vary a lot because the age of juvenile jurisdiction versus adult jurisdiction changes this. So in a state where they've raised the age to 18, so anything that happens by somebody under the age of 18, except there's sometimes carve-out crimes like murder. So a 16-year-old who kills a parent may still be tried in adult court. And so it changes what the punishment or the treatment will look like. And yet, again, the possibility for release may be more likely, again, for the juveniles. So what do we do about treatment? Treatment's tricky because immediately post-event, there's a lot going on for that person. Immediately post-event, if they're arrested, they're going to be brought into a local jail. If they're psychotic, they may not get access to care. They may be struggling with the realization of what they've done. Even if they're not psychotic, they're going to be having an adjustment to what's just happened. Again, killing a parent is different than killing a stranger in terms of that emotional onslaught. And when somebody's processed in a jail, they're just processed in a jail. So and if they're processed in a juvenile detention center, often there's limited support going to be available to talk about what happened because there's all these protections around the person's legal interests. And if they start to talk about what they did, they may be compromising their Fifth Amendment rights. And so you have somebody that just perpetrated this horrific crime or deed, and now they're like alone in a cell grappling with this new reality. And this is when I talk to people, and it is a fascinating role interviewing all these patients over years of processing this, what they go through. And so the ability to psychologically process the crime the way our laws handle it is pretty limited if competency is raised, and even if it's not raised. So suicide risk goes up. We know jails, the most frequent cause of death in a jail is suicide. Despite the world's efforts to make jails better, the suicide rates are really high. Aggression because of heightened emotions, people processing this. And then remember, if this happens with the youth, they're still developing. Their personalities are still developing. Their brains are still developing. So now they've got this major trauma. And if they appear callous, it may not really be callousness. It may be post-traumatic stress symptoms. Aggression may be related to emotions. And again, there's some other bodily functions, psychosomatic functioning can shift. And so as this is happening, they're developing, and now they have to incorporate this into who they become. And so when we think about treatment as usual, there's nothing, again, they're just merged into these populations. They may get general therapy, they may get medications, but these therapeutic supports are critical. And so supporting them in the here and now is really what we try and do, even when they can't really talk that much. Sometimes defense attorneys will hire a specialist to work with somebody so that they can talk under the attorney-client privilege. That gets complicated too. Now, families are super interesting around this because remember, there's going to be potentially surviving family members. And I have seen the most amazing examples of forgiveness, and I have seen the most understandable examples of non-forgiveness. And you kind of have to understand it either direction, because reconciliation with the family may not be the best idea. It may be just too much for the family members. And I've seen family members, picketing that they don't want somebody to be released from a hospital to go back to the neighborhood. It's too triggering for them. And then you get into rights issues of this person, for example, who's found not guilty by reason of insanity, has the right to live wherever they want. But what do you do with that? And so we don't want to always think reconciliation is the answer, although it can be the answer, and it can be helpful for families to process together what happened, especially where illness was involved, but even where illness was not involved, for the surviving family members. If there's grandchildren, that's sometimes, or nieces and nephews, that's sometimes another motivator to think about what that's going to be like. So often that requires monitoring and oversight and a lot of active engagement. So letting surviving victims dictate terms is going to be really important, more than the perpetrator. And the community might also have feelings about this. But how siblings and parents respond can have a major impact on the individual and their own sense of guilt and their own sense of remorse and recovery. And so, as we think about what does visitation look like, what happens during those visits, testimony in future court hearings, you have to work with the person. I've worked now a couple times. I've seen a young man who killed both his parents in a tragic manic episode while he was at college. And, he's got siblings and aunts and uncles, but what he's really processing is he's not going to have any family when nobody right now, people are not ready to go back and talk to him. And so there can be this intense isolation that we have to work with. Supervision upon release can be variable. It depends on the state that you live in. In Massachusetts, there is no supervision. If you're found NGRI, they're just out. And, having now worked in multiple states that have all different ways of dealing with NGRIs, from court involvement in Ohio to an NGRI committee that oversees things in Michigan for 5 years to Massachusetts, I don't know really what's the best. I don't really have an opinion. I think it's all very interesting and complicated. Some people, if they're found guilty, might be on parole, but you can't assume that there will be supervision. And then what does the supervision actually mean anyway is a whole nother thing that, what does it look like if somebody goes off their medication? If they're on parole, do they come back into the prison system? Is that the right response? So long-term prognosis is guarded. There can be foreshortened survival rates. Suicide risk can be high in the long run. And the shortest survival, according to the epidemiologic studies we have, is for males who commit matricide. So prevention, how do we think about prevention? If we could go upstream, what would we do? Who's at risk? Understanding cultural issues for these dynamics, people who have fascination with violence, weapons and killing, substance use, aggression, chronic family dysfunction, abuse. These are, it is a bit like a needle in a haystack, but these are the general strategies that we can think about prevention. There are ways that we can think about potential triggers. I once did a case of a a daughter who was seeking guardianship for her delusional parent. The delusional parent had begun to believe that her daughter was replaced by an imposter and had been struggling with, I think, medical problems and some emerging neurocognitive challenges in addition to her delusions, or maybe that was what was causing the delusions. But in that case, it seemed obvious that the daughter would not be the ideal guardian, because it's just a setup to have this guardian making decisions for the mother when there's already this potential risk of this delusion. And it turned out that mother in that interview seemed like a very nice lady who was just on the, starting to just be a little suspicious about her daughter, being paranoid a little bit, like, I'm not sure it's still my daughter. And when I said, well, it sounds like sometimes you're a little bit scared, she said, yes. I said, well, have you done anything to try and, protect yourself? And she talked about how she went to a firearms shop and had gone and looked to buy herself a pistol. And this was somebody who, I literally went in to do an evaluation on behalf of an attorney about guardianship. So a whole new set of risk issues emerged from that. But so, recommending that the daughter not be the guardian seemed like a no-brainer to me. But, that's not always easy, because there's not a lot of people that want to step up to be guardians. And so if that daughter had to be the guardian, then what would be the risk mitigation strategies that you would want to invoke? Safety planning, when the child has substance use challenges, again, remembering that these things can happen in the home, really doing that safety planning, means restriction, identification of child abuse early on, obviously, is big. So let me just conclude with telling you a little bit about what happened. Actually, literally just May 2nd, I saw there was a press release as I was preparing for the grand rounds on the Menendez brothers. Even though they said they were not going to be eligible for parole, a new person has emerged. There's a documentary that was released that I haven't seen yet, that a new person is describing the sexual abuse that he incurred by their father. And so there's a possibility that this will change the course of their ability to appeal their case. They had previously exhausted their appeals. Both of them, I believe, got married while they were in prison to people outside of the prison. And I believe now they are moved into the same prison in California, which is interesting. In this case, the Parker Hume murder, Juliet Hume became Anne Perry, who's a renowned writer. She writes wrote criminal fiction. She spent 5 years in a local adult facility. I think she was the only child placed in that facility. She described that she spent months on her knees praying for forgiveness after the crime. She began being befriended by some seamstresses at this women's facility. She was ultimately released at the age of 21 after 5 years. And she had to leave the country. She went to Rome to be with her father. And then she developed this career as a famous crime writer. She's been more outspoken about what happened. Pauline Parker, they were both required to change their identities because this was such a notorious crime. Pauline Parker became Hilary Nathan. She now lives in Scotland. She's lived a very quiet, reclusive life. She became a writing instructor. It's, again, just the outcome tragic. So there's some references for you, and I have a few minutes if there are any questions, and I really thank you for your attention to this talk.
So we have a few questions online, but are there any questions in the room? All right, well, raise your hand if you do. Here's a question from online. Are those who commit parricide found not guilty by reason of insanity or the jurisdictional equivalent more or less often than other violent crimes?
Yeah, I would say, I don't know if there's been a study that's actually looked at that. Certainly where there's psychosis, it's not uncommon to be found not guilty by reason of insanity in these cases. And often it's an agreed upon by the prosecutor, especially where there's this overkill and it's an obviously psychotic crime.
Okay, in terms of contributions of abuse, is there a breakdown of physical versus sexual versus verbal, emotional abuse as contributing factors? Any data on deprivation, neglect being a contributing factor? And is there any evidence for a higher or lower prevalence of autism or developmental delays?
You know, it's interesting. After the Newtown shooting, our court clinics, when I was assistant commissioner for forensics, our court clinics got a lot, Jerry will remember this, a lot of referrals for evaluations just because people had autism spectrum disorder. People just started to make this grand assumption that and so we have to be careful about that because that's not actually accurate, that there's this automatic association. Again, you have to look at that individual. So I don't think there's a clear breakdown of sexual abuse versus emotional abuse versus physical. Certainly sexual abuse over long times is something that you see in a lot of these cases, but I haven't seen from a data perspective whether one type of abuse is going to create more risk than another. I think the point is that where the child feels that they're in an untenable situation and the dynamic is one that they feel like they have no escape from, then that's when the homicide can occur.
One of the audience members is curious to hear your thoughts on Gypsy Rose Blanchard and how her case was typical or atypical.
I don't know that case.
I didn't either.
have to look it up.
I Googled it. Young woman in Louisiana, I think, murdered her mother, went to prison for 10 years and is out, but that's all I could read quickly. But oh, right. Oh.
The Munchausen's by proxy case where the parent was really.
There's a lot of diagnoses that didn't quite make sense.
That's a form of abuse, we know.
Yeah.
Right. And so
eventually she kind of connected with another person, and then they eventually came up with a plan for her to have her own adult life, but had to apparently end their mother's life to do so.
Yeah. Well, I mean, I think that's, again, just an example of a case where there's abuse. What's interesting for the kid case, now I've brought up two cases. Here's a third where it looks like there's a partner, sort of a partner in crime, if you will, bringing in a peer. That's not unusual. I mean, we've seen that in some of the school shootings and things like that. Bringing in a peer to help is not unusual. So that's another thing to think about in terms of social spheres. You see that, I think, more with kids than you would with adults.
Is there any correlation with parent victims who are the full-time caregivers for their son and daughter or vice versa?
I think the correlation is where there's more of an intense dynamic, and that doesn't necessarily mean the caregiver. So for example, even if the father is not the caregiver, not to be stereotypical, but is aggressive and abusive, that's going to be an intense dynamic. So it's, but if the full-time caregiver is more enmeshed, then that's going to be the dynamic. It's more about the dynamic, I think, than, who's physically spending more hours with the child.
Do you believe that juries and judges are considering the role of trauma in cases of parricide more and more as time goes on?
Judges are getting a lot of training these days on trauma and what does trauma do to the brain. And I think, juries, I don't know what juries could do. I don't know what juries would know. I mean, the world knows a little bit more about trauma. Certainly now with COVID, we all know a little bit more about trauma, but do people really integrate that into their decisions? Sometimes juries will see the gruesomeness of a crime and not be sympathetic because it's so gruesome. That's often one of the hardest things, is to just have people realize that this cold-blooded bludgeoning thing was, should be in some ways forgiven, if you will, through legal means. And that's not always what juries want to see. And often these cases are tried by a jury.
And also, doesn't it depend on the law? I mean, what the law...
States that have diminished capacity arguments that you could bring up, and there's different laws if they don't rise to the level of being psychotic and having an insanity defense. Substance use alone is usually not going to be something that's going to mitigate culpability in the moment. So it can depend on the law. There's a lot of different legal strategies that one might use. I think if there is psychosis, you're going to see people raise the insanity defense, I think, pretty often, because sometimes that's your best. I mean, it's not like you can say the person's not guilty. There's often total evidence of who did the crime. So then you're just trying to get some kind of defense strategy that's going to get your client the best outcome.
Okay, well, we're after 1 o'clock. Listen, thank you so much. It was a fascinating talk.
Thank you, everybody.